Hello, and welcome to today's webinar event powered by Vine Medical. Vine Medical has the pleasure of hosting today's webinar event titled Automation is Critical for Patients and Your Healthcare Organization with John Lynn and Shereese Maynard. We will begin this event moderated by Vine Medical's Senior Advisor David Sims shortly. Afterwards, we will have a no-holds-barred Q&A session. We may not have the opportunity to address all questions during the presentation, but please feel free to ask any question in the questions section of the platform, and we will get to as many as we can during the Q&A at the end of the session. This webinar is being recorded, and when the live webinar concludes, our system prepares an email to be sent to the email address that you registered with. We know that a lot of you would like other members of your staff to be able to watch the webinar, so please rest assured that it is recorded and sent as a follow-up. Thank you.
Good afternoon, and I guess for those on the West Coast, good morning. Thank you for taking the time to join us today for this webinar, talking to the value of automation and the benefits that it brings to healthcare. My name is David Sims. I'm a senior advisor with Vine Medical, and as I mentioned, we are thrilled to have you here today. Want to introduce our panelists today. We have John Lynn and Shereese Maynard, who will be leading the conversations and providing their insights to healthcare automation and the significance it brings to the patients and to your organization. Before we begin, I would like to just introduce our panelists and give you a little bit of information about them. First, we have John Lynn. John is the founder of healthcarescene.com, a network of leading healthcare IT resources. His flagship publication is Healthcare IT Today, and contains over 15,000 articles, 3 podcasts with over 500 episodes included. He also organizes the first of its kind conference and community focused on healthcare and marketing. It's called Healthcare and IT Marketing Conference. And John also serves as an advisor to multiple healthcare companies and is highly involved in social media. And you can find his blogs, and this is his blogs. You can find him on Twitter as @TechGuy. So welcome, John. Next, I'd like to introduce you to Shereese Maynard. Shereese is a technology expert and a healthcare marketing visionary. She's the co-founder of NostraData Medical and the founder of AskShereese.tech, a healthcare IT strategy and marketing firm. Shereese also co-owns Hit Like a Girl Pod, a community platform for women in healthcare, for women in healthcare technologies. Health Tech Magazine recently listed her as a top 30 healthcare tech influencer, while Pixel Health has placed her in their top 10. Shereese is a highly sought after healthcare strategist, and we're thrilled to have her joining us today. Again, thank you, Shereese. Again, John, Shereese, welcome. And I know we're all looking forward to hearing some of your remarks on automation. And with that, I'd like to get us started. So Shereese, if it's okay, I'd like to hand it off to you with the first question, just to kind of get the conversation going. From your perspective, with the evolution of automation, what are some of the biggest advantages? What are some of the biggest advantages that are standing out as you see these healthcare systems turning to automation?
Well, thank you for having me, David. That's the first thing. I'm very happy to be here with John. So with regard to automation, I see 2 key areas that are affecting us right now. When you think about in terms of claims and pre-authorizations, that's where I see automation coming to the rescue of providers and organizations. But you also have to think in terms of our healthcare workforce right now. So the other place where I think automation is front and center and that can make a big impact is in staffing and our healthcare talent that is missing, those gaps.
No, absolutely, and we're hearing that in our conversations daily with some of our clients, that is the staff shortages and finding the resources is very difficult. So, John, what are your thoughts? What have you seen?
Yeah, I think when you look at, the health IT community and healthcare organizations in general, we're hearing 2 major problems that these organizations are facing and this, are consuming all of their bandwidth. One is what Shereese mentioned, which is the workforce issues. How am I going to deal with this workforce issues that we're facing? And by the way, those workforce issues are coming in multiple layers. One, it's providers that are burnt out and leaving. Two, it's staff that now can work remotely and are leaving organizations because they have more options available to them to be able to leave. Third, there's a demand for technology talent that's just extreme as we all implement new technology. So technology staff is a challenge as well. So you have like multiple things happening that are causing stress to the workforce. The second is revenue. We all know what happened during COVID. Revenues just got hit in a big way. A lot of the elective procedures stopped, which was the revenue source for many organizations. Now supply chain challenges are increasing, and the cost of your supply, of the resources that you buy are going up because of inflation, et cetera, right? So all of these are causing revenue pressures on an organization. So those are like the two topics that all of these healthcare organizations are suffering under. And when you look at those two things, it's interesting because automation is something that can help both of them. Automation can help you with your workforce. In fact, it's amazing the mindset shift that's happened when it comes to automation. When we talked about automation, say 3 years ago, and we're like, oh, we want to automate you, what would employees say? The employees would be like, wait, are you trying to take my job?
Yeah.
And you're like, I don't think we want to do that. Like, that sounds scary. Are you going to fire my friend? Right? You're like, that was a fear that they had with automation. Now, when we bring automation to the table, and we, especially when you're talking to, nurse staff that are overwhelmed with short staffed, right? Or even your revenue cycle staff that they can't hire enough, right? You go to them and you say, hey, we want to automate this. And they say, heck yeah, like, please implement it, because right now I'm doing 3 people's jobs. And so if you can automate something and make it so that I can do this more efficiently, then please do it. So to me, that's what's so powerful about what's happening with automation, is that the people are ready to accept the automation because they're doing 3 jobs already, and they need these solutions to be able to help them.
Yeah, you talk to the people involved. So you think back to, like, we're probably in a 3rd generation of automation at this point. So you think back to the clinical leaders who were the liaisons back in the day. And correct me if I'm wrong, but I don't really recall a CMIO being a title at the hospital systems. But now every hospital seems to have a medical information officer. So they've taken that clinical role, used their liaison experience, and now they're the expert, which is it's been a pretty nice transformation and change.
Yeah, and they've had to, right? I mean, let's be honest, they're under a lot of pressure, and they need the information to guide what they're doing. I like to talk about in healthcare, to be frank, we kind of took patients for granted for a long time because we were getting paid a lot to be able to do it. And, there weren't that many options for patients. Well, now patients have a lot more options. And so we need to provide a better patient experience. We need to provide, an effective care. Of course, they've always been striving for that, right? Providing quality care. But now they want that care to go with the experience, and that experience spans so many areas, including what happens in the hospital, including what happens when they schedule an appointment, including what happens in their revenue cycle experience. How do they pay for their actual, visit? So, all of that is demanding more from people, and we have less staff to do it.
Yeah.
And I would add to that we were doing the same thing to clinicians, right? We were asking doctors to do more with less. We assumed that they would just catch up to technology and that type of thing. And that's not what happened. We ended up burning them out. And before, the idea of burnout or stressing physicians was kind of driven into the darkness. We didn't talk about it. We don't like to think about heroes as being flawed in any way, shape, or form. But then we saw that, hey, these things, these technologies, these different workloads we're bringing to doctors, they're burning the doctors out, and we really need them to be healthy. So automation gave us an opportunity to fix some wrongs from our past, I would add.
What are some of the lessons that you've seen that we've learned now that we have more and more implementations? What are some of the best practices that have benefited the healthcare systems through implementations?
Oh, well, I think one of the things is that any automation you bring into your environment has to be purposeful, right? So you can't just throw things at an organization and expect everybody to get on board. It's like John said before, telling people we want to automate you was like almost this dirty word we came to the table with. And the other thing is, people tend to think of automation as sort of an assembly line or factory type of solution. And then we were able to then talk to organizations to convince them that, no, we're not looking at assembly line stuff. We're looking at precision. We're trying to make systems more efficient. And that is the buy-in for clinicians. And it is also the buy-ins for staff to be able to get their work done in less time and more efficiently. And that is the selling point. So it's not that we're trying to replace humans, no. And I always argue that technology is never to replace, it's to, augment, it's to help in a situation. Yeah, so what we have learned to do is sell the idea of help and precision as opposed to assembly line sort of thinking.
And I think that's the other shift that's happened with automation, because in the beginning, things like RPA, robotic process automation, was more, how do I automate this assembly line? But now, I mean, just look at ChatGPT. If you've touched that at all, which I think we have to mention these days because it's so sexy and exciting, right? Like, it's so personalized to that individual experience. And that's what's happening with most of the automations that are happening in healthcare, is that they're understanding the data, which, by the way, 10 years ago, we didn't have the data. It was all stuck in paper charts. So how do I even automate something that's in 10,000 paper charts? You couldn't. Well, now it's in the EHR. For all its weaknesses, we won't go there today, but for all its weaknesses, the data is there where we could do something with it. And so now we can create that personalized payment experience, or that personalized check-in experience that understands more about the patient, or that personalized outreach that gets automated to see how are you doing with the care plan that your provider created. Like, all of those things can be personalized because we have the data. And that's the massive change that I think's happened over the last couple of years, is that we have the data that allows us to personalize the automation so that it's not just an assembly line thing where the doctors, the nurses, and everyone will look at it and be like, why would you do that? That doesn't make any sense. Because you're right, it doesn't make sense if you have the right data. So I think that's the first thing that is just so powerful, is how much better the automation is, because it can be personalized to the individual or to the cohort or whatever you're doing. The other thing, back to your best practices, the lessons learned from this, when I look at it, I think one thing we've learned is that the bar in healthcare is still do no harm. Right? Like that is still the culture of healthcare. And I don't think we're ever going to change it. And I'm not sure we should change that, right? Like, that should be the goal, overarching goal of healthcare, is to continue to do no harm. But when you look at it, you also have to think that and understand that what we're doing today is harming patients. Right? So, like, if we don't implement automation that, like Shereese said, is more precise and can provide more precise care and more customized care at scale to all of your patient population, like, if you don't do that, you're causing different harm. Right? So, it's important as you implement automation to remember that automation doesn't need to be compared to perfection, which is an easy thing to do, right? You're like, well, it's computers, they should be perfect, right? Like, and they do well, right?
Yeah, that's the assumption, right? Yeah.
Yeah, but we shouldn't compare it to perfection, because that's not a fair comparison. Instead, as we automate, we should compare it to the status quo, which is imperfect as well. So I think that's a great lesson to learn, that you look at it and say, hey, it's okay if it makes mistakes. Let's understand it. Let's mitigate those mistakes. Let's see how we can put a human in the loop when there is something that could be a mistake, right? Whatever that might be. But let's also look and say, our current process is flawed as well. So can we use automation to improve it, even if it's imperfect?
Yeah, it's interesting you say that. I'm talking about the difference between the industries. Healthcare obviously is do no harm first, like you mentioned, but I had a conversation with a CIO here in North Carolina with the healthcare system, where they actually brought in someone from a large out-of-the-box COO, and they wanted to just kind of get a grasp of where's our technology and automation versus what you're doing in the retail world? And decided to go for like a little 6-month test pilot, but came back shortly after and said, listen, if we start right now, like this healthcare system, we're so far behind. We're 3-4 years behind on catching up with the data's not there, right? The information's not there to be shared. So we take a HIE where the data is available, and I think that has a huge impact. Or maybe give me your thoughts on the HIEs given the data and making it more accessible to share among multiple systems, patient information.
Well, I mean, I always make the joke, but a serious joke that, you know, in healthcare, as compared to other industries, we're always like British fashion, 5 years behind the trend, right? So we are behind, but it is, you know, we are getting to a point where we understand that we need to catch up. And one of the things that we are doing is making data more available in real time, which is very important because it helps you give the best care to the individual. And even if you look at, you know, Rev Sci, we're still at a point in healthcare where we're at 20% claims denial. It's actually trending up, more denials. So automation allows you to alleviate some of these transactional inefficiencies. And we know that 90% of the claims denials we see are 100% preventable through automation. So, you know, we're moving in the right direction, but it is a lot of catch up that we're doing. And I always remind people that health IT in this country is still in infancy. We're still learning a lot of things, but automation is allowing us to catch up faster than we had been in the past, and we are learning more day to day.
Nice, perfect, thank you. Scott, what do you think? I'm sorry, John.
Yeah, no worries. Yeah, no, I mean, I think there's so many elements to this, right? You know, one is the data clean enough for us to do it? But guess what? This interoperability that you talk about, the HIEs, they're going to highlight that, right? We have a great article on Healthcare IT Today from Clinical Architecture where he talks about that. What is Tefka and QHIN's going to do? It's going to highlight the quality of our clinical data. Because when we just started sharing it with ourselves, we realized, ooh, our baby's kind of ugly, right? Like our data has issues, right? We're looking in the face. Well, now we're going to start sharing it with other people. And guess what's going to happen? We're going to find out everyone's baby's ugly, right? Like,
no, exactly.
Data has flaws. And so, you know, that we're going to understand this. The good news is actually automation can help this as well. Automation can help clean your data. I had one organization that I talked with. They said, hey, 50% of data is quality, right? And you can just use it. You don't need to do anything with it. And he's like, with good AI and good technology on top of it, we can clean up the other, and I think he said 30 to 40% of the data using technology and automation to verify and cross-verify and check and whatever to verify to make the data clean. He's like, and then there's that 10 to 20% where, you know, there's more work to be done, right? And it's going to take more effort to clean that data. But so, you know, the automation is going to help us in this regard and help us to be able to clean the data so that we can trust it. I think, again, it goes back to, you know, even what Shereese said, right? Like, hey, we have problems getting claims filed already, right? Like, let's not act like we're already a perfect system and that we need to apply automation to the perfection. And I remember an organization, you know, Dr. C.T. Lin, he implemented this solution where they provided, I think they were providing results from, you know, from their system to patients. And they had done it for 2 or 3 years, tens of thousands of patients that have gotten these results. And then there was this flaw in the system, right? Where they actually did the, you know, some patient got information and they caused some harm, right? Like it was a sad thing and it shouldn't have happened and it was awful. And they looked at it and they're like, we need to stop sharing that with patients. And Dr. Lin was like, wait, no, let's step back a second, right? Like this was one incident of thousands and thousands of people who've done it that have benefited from this new process, right? Should we throw the baby out with the bathwater, right? And of course the answer was no. Like, sure, we need to figure out how to mitigate this in the future, and that's fine, and let's understand that. But let's be careful that we don't, you know, throw out these really good things because of one edge case that was, you know, probably shouldn't have happened and normally wouldn't have happened, but did happen. And let's understand that. How do we mitigate that for the future? But let's embrace automation and what it can provide and just understand that sometimes there are mistakes.
Perfect. Oh, thank you. I appreciate that. So in terms of if a healthcare system is showing some hesitations in trusting automation, what do you typically find that hesitation to be? Where's that I need to get over this next hurdle and help me get there? What would stop them from going, do you think?
I don't think it necessarily stops them from going, but I think the first pushback is always, here's this other thing now you want us to do. You wanted us to adopt this, and now you bring this other thing. I think the pushback is against the cost of implementing automation, which we know that while it does cost to automate, it also saves money in the long run. So you don't want to shortchange yourself by taking the short hit for long term gain. So those are some of the pushbacks. And where I see a struggle is like the education and having the talent in place to understand the automation and that type of thing. But we do know that when you invest in training people to use the automation, it saves you money, it saves you productivity and all that in the long run. And one of the giant ways it saves us in the long run, and that is a selling point when I talk to clients, is that if you have a system and you have, normally if you think of a healthcare system, you think of like the pre-registration process, the different departments and that type of thing, the discharge process, where before all those things had to sort of function in isolation of one another. Now through automation, you can make all that stuff work seamlessly, which helps the patient and which helps clinicians. And I find that when you explain that in terms of dollars and cents for organizations, they're faster able to adopt the idea of automating processes, because we don't need things to operate in isolation, because that patient's journey should be as seamless as possible from presentation to discharge.
Right, and every patient journey is different, so you want to have that patient experience to make it just as fluid as possible. So, right.
Yep, and I agree with Shereese. Like the biggest challenge is that there's hundreds of pressures on CIOs and CMIOs and everyone across the spectrum of what they need to do, because there's so much opportunity for technology to impact healthcare organizations for good. The question is what should you do and what aligns with your strategic priorities? And so you really need a visionary leader that understands that, hey, we can't do business the way we've always done it. We need to invest the time and effort in automation so that we have the time later to do even more for our patients, for our staff, et cetera. And so I think prioritization is going to be one of the biggest challenges in having that vision and understanding. I mean, we've all done this, right? Like I think about some of the emails that I need to automate because, I send the same email to that same response every time, and I just need to create a macro to be able to do that so that I don't have to type it out. And do I get to it? No, I just keep doing it. And then I finally do it, and I'm like, why didn't I do this earlier? Like, I think a lot of healthcare organizations are in that same boat where they're like, I know that this is monkey work. I know that this is repetitive and that the process is the same. Like, why am I doing this over again? But you don't, many of them, and I include myself, as I just described, we don't make the time to automate it because that takes a little more work on the front end, but the benefits on the back end are just so powerful that it's worth it. But I'll throw another idea in here, David, if you're all right. Like,
yeah, please.
What happens if an organization doesn't automate? Like, think about what your future of your organization looks like if you don't automate. Not only are you not going to be competitive with the other organizations that are automating, because now you're not as efficient. And that, hospital across the street, that practice, next door that's competing with you, right? Like, if they're more effective and they've automated, they're going to have more time to do more for the patients and more for their clinicians. And that's going to be a powerful thing. But then even moving beyond that, we talked about at the beginning, workforce is the biggest issue facing organizations today. If workforce is your biggest issue, do you think staff that you want to hire, whether that's your medical coders or whether that's your doctors and your nurses, do they want to go work for an organization that's backwards and that hasn't automated? No, I mean, this is going to become a recruiting problem for healthcare organizations. If I've been working at an organization that's automated all of those faxes coming in, right, or all of this claims processing, right, to be able to, all the low balances that need to be processed. If I've been working at an organization that's already automated that, and all I'm doing is the high level stuff that actually takes human thought and ingenuity, Like, and am I going to move to another organization and be like, oh, by the way, we still send those by paper, right? Or, you know, like,
backwards, right?
yeah, I'm not doing that, right? And so the workforce problem is going to become a bigger issue for organizations that don't automate, because people aren't going to want to go where the automation hasn't happened. They're going to go to organizations that have. And it's kind of counterintuitive, because you think you're like, oh, you automate, you don't need people, that's the false way. That's the wrong way to think about it. If you automate, more people are going to want to work with you.
Yeah. No, and I
And I would
think,
say this,
I'm sorry, Shereese, go
I
ahead.
was going to say it's the same for patients. Patients want to go where they can have a seamless experience. So one of the greatest tortures as a patient is if you have to go somewhere and you register, let's say for labs or whatever. If you have to go each time and register and fill out the same paperwork, that patient's not going to be happy. But if you have automation in place where they don't have to refill out a bunch of forms again and redo a bunch of things, and you can alleviate some of those extra tests that you're doing because you put automation in place, a patient is going to have a better experience and they're more likely to stay a patient, a loyal patient.
Yeah. And I think kind of think of it in terms of from the clinical side, the old 80-20 rule we talk about, right? So clinician on the clinical side, they're spending more of 80% of their time not with the patient. They're there for compassion care. So they're spending so much of their time documenting and doing these manual processes we talked about. So conversely, on this end, on rev cycle, you know, that process elimination of that 80% of all the heavy lift work that's being done, and back to the patient care and back to the things that matter most for the organization or for a healthcare system to streamline.
Yeah, and I think we misunderstand how much this automation can create an incredible patient experience and the impact that has on the downstream staff, right? I was at the Qualtrics user experience conference, right? They talk all about patient experience. They measure it like crazy, right? Like that's all they do. And they highlighted it so well that, hey, if you don't automate the experience for the patient on the front end, right? Or if you don't do it in the revenue cycle side so that they have a great payment experience, right? So that they understand what's going on, right? Then what are they going to do? They're going to take that out on the nurse, right? And then they're going to take it out on the doctor, and the nurse is going to be burnt out, which is going to, so there's these downstream impacts that happen when you don't take care of things properly on the front end and the back end, right? That then your staff suffer because the patient had a bad experience.
Yeah. And how do you see these KPIs being benchmarked? If we're talking about the patient satisfaction or the staff satisfaction, what are some of the indicators that you're seeing that are achievable, or what's achievable through automation to get those numbers up?
Well, definitely, if you're talking about the key indicators really are the loyalty of patients, because patients will come back where they feel most happy. And if you can see patient outcomes improving. So if you think about how we're using automation now to get data to the right place at the right time, 100% you're going to see outcomes increase. And that's what you want to see. So if you're seeing your patients who before were having repeated issues or repeated readmissions, and now due to your processes being more automated, you're seeing less of that. That's your best indicator, because at the end of the day, what we want to see is happy physicians, well-adjusted, thriving physicians, and healthier patients. So it's like John said, we're not looking for perfection, we're looking for better. And through automation, you constantly are getting better.
Yeah, I'd throw in also that you have to look, like you said, David, look at the retail experience and look at the brand that healthcare has, right? What's the brand that healthcare has? I'm going to wait long times in the waiting room. I'm going to have no idea what the bill is. I'm going to have no idea whether I should pay the EOB or whether another bill's coming. I'm going to wait in the waiting room for a long time. I'll have to wait 2 months for a specialist. Like, everything I've described is like bad experience, right? But yet we were held captive, and so we did it because what's our other option? Well, it turns out now there are other options. And so retail health's coming in. What's the brand of Amazon healthcare? one click, easy, shows up automatically, right? Like, what is CVS? CVS Minute Clinic. Like, now, whether this is even true or not for retail health, right? Like, that's a whole nother discussion, right? But their brand that they're doing is, oh, it's going to be 1 minute. You're going to be in and out. You're going to have an amazing experience, right? And so, like, we have a brand problem in healthcare that we need to deal with, which is that, right now it's seen as inconvenient, something I don't want to do. And so that's, I think, the benchmark, right? Is how do we compare to these other experiences that have a great brand that are going to say, hey, this is going to be an amazing experience for you. And like I said, that's our challenge, whether that's true, whether they're able to deliver that kind of amazing experience or not. The brand message in our head is that's going to be easier than this old health system, this old medical practice that's going to be a pain and takes me for granted.
Yeah.
And you'll see from patients, I always think that sometimes the things that we've corrected, patients don't automatically see. But I do recall a time when patients were carrying charts and stuff back and forth to doctors, and they would have to wait 2 days to go back to their doctors for results from a test. But now through automation, we know if a patient goes and has labs done, if they have an appointment at their other doctor's office, by the time they get there, those labs could be done. All that's done through automation, and it makes the whole process more seamless for them, a better experience for everybody.
And let me just throw in as well, like, think about what automation can provide an organization, because, I need a shout out to all the nurses and all the doctors and all the front desk staff and all the revenue cycle people, medical coders, et cetera, right? Like, the clinical staff are the most caring, thoughtful, kind people. You don't get into healthcare to make a bunch of money, right? You get into healthcare because you understand the mission and you want to help those patients receive the care that they need, right? And then what did we do? We actually sucked the life out of them, which isn't very much of an exaggeration, right? By burdening them with all this administrative overhead, which is just a pain in the butt and causes the burnout that we're seeing in these organizations and in these people, right? And so, like, we essentially sucked the compassion out of so many. And credit to all those nurses, doctors, front desk staff, et cetera, that push through it and still are caring and compassionate, and they do an amazing job, right? But they're doing it against, it's like swimming upstream in a river. I just did kayaking up a river. We kayak up the river to go to this cove, and it was miserable. And then we paddled down, and we were going downstream, and we went like this, right? It's like, that's what we've asked doctors and all of our healthcare staff to do, is to battle against this administrative burden, which is just a pain in the butt. And what automation can provide an organization is to automate a lot of that administrative burden, so that now those staff can paddle downstream, that we can paddle down together, and they can actually do what they loved in healthcare, which is show compassion and care at the highest level for their patients.
Yeah, perfect. Yeah, it's the possibilities are endless. I'm not really seeing any limitations to what automation can bring to healthcare, and to operationalize everything and streamline the data exchange. So, first and foremost, John, as you said, it's compassion of care. And, I think that the lessons that we've learned in the past couple of years is we get into more and more automation. We've got a long way to go. There's some great opportunities out there, and let's just capitalize on them and try to get that reputation back if people aren't aggravated to go see them. Yeah.
Well, and we all want to, right? We all feel like the doctor cares about us, and we want to be there, right? But we also want convenience. So convenience is compelling as well. So, it's interesting you say, there's no limitations. I'll tell you what our limitation is. It's fear of change, right?
Yeah.
Like, I remember so many people sitting on these practice management systems that were awful, right? There was better solutions out there. And you'd go to them and you're like, why are you using that practice management? Why aren't you going to a better one that integrates with the EHR and automates the process of billing, from the EHR directly to the practice management system? And they'd look at me and they're like, it's the devil I know.
Right.
right? And I'm like,
Yeah.
I get it, right? Like they're afraid to change because change does require you to change, and no one likes to do that automatically. So, a lot of this automation does require a new way of thinking and a change in process, and so it does require you to be uncomfortable in the beginning, right? But it's like the what's the Dave Ramsey say? Live now like no one else, so that later you can live like no one else. I think that's true with automation. Like it's a little bit of suffering in the beginning to understand the process, to change how you handle, whatever you're automating, whether it's your revenue cycle or whether it's your labs or whatever, right? Yeah, a little bit of an uncomfortable experience now leads to amazing things at the end.
I agree with you 100%.
Even if you think about claims denials alone, that's enough to that should be enough to inspire people to just adopt automation, because like I said, we're still seeing those denials go up where automation can pretty much alleviate that problem for most systems. So yeah, it's like why would you stay in the past and suffer when something so much more beautiful and comfortable is up ahead?
And as we capture that data on the front end, that just the more data we capture, we said, John, you said this earlier, the more data that goes into our data fields, the more, the better the outcomes will be. So getting good, clean data on the front end is going to hopefully drive to some successful stories.
Yep. I think the other key, David, is when you implement this, make sure you involve the staff so that they understand what's happening. If you drop an automation process on staff, they will kick and fight against it just out of pure nature, right? Like it's just our nature, like, oh, you're going to change something? Oh, I'm going to fight that. I'm going to show you where you're wrong, right? Whereas if you involve them on the front end, and so then they understand, oh, this is actually going to help me. And I was involved in the selection of that, and I was involved in the workflow of that. Now I can't kick against it because I was involved in it, right?
Yeah,
And by the way, it's just good design to understand, oh, by the way, do you know we have this other payer that doesn't use that, that standard? Oh, we should address that, right? Like, so I think, getting the staff buy-in early on is the other best practice with any automation, because one, they'll understand I'm not replacing you, I'm augmenting you, I'm making your life better. Two, you are part of the process. And so now you want to help make that process successful because you were part of it, right? Rather than kicking against it and fighting against it. So, having that staff involvement and having their voice heard and having them see a part of them in that project is one of the most powerful things you can do when you implement any automation.
Yep, it becomes their baby.
Yeah.
Right?
Yeah, and an uninformed, uneducated staff will sink your ship. I think one of the places where organizations often don't put enough resources in training their staff on automation coming in, so that they can get the long-term benefits. Because I have seen organizations where they didn't include staff on the front end, and where staff will create their own workarounds and stuff, and that'll mess up the whole thing. So it's important to get them involved and get the buy-in from them so they know that, hey, this is something for them as well as for patients, and so you can benefit from them long term.
Here's another hack, David, real quick. If you implement it side by side, that's another trick on automation, right? Like implement the automation so they can see what would be done by the automation and what they would do. And then they look at it and they're like, well, why am I doing double work? It's one of the best tricks, right? Because they look at it and they're like, oh, I mean, it's already done. Why do you have me doing this? And then you're like, okay, fine, we'll implement it for you. But like, it's this fascinating, mental psychology around it, right? Like, hey, we're gonna do it side by side. You can compare it, and then they look at it and they're like, so why are you forcing me to do all this work when it could have done it itself? You're like, oh, that's a good point. Let's implement it. So that's another like little hack.
Let it be their idea.
We just had someone post, innovate or die, right? That's the philosophy. If you're if you're not going to do it, you're, like you said, you're behind, and you're never going to catch up to the hospital system or the provider down the street. So
Yeah, I mean, I think we have to be a little careful with that, right? If you have a 3-month waiting list and you're a specialist, guess what? You know, you're probably not going to die, right? The demand is so high and stuff. But here's the problem with that is it's still the right thing to do for your patients, right? It's the
Mhm.
right thing to do for your organization. Guess what? You can move that 3-month wait list to a, 1.5-month wait list and drive more revenue, right? So there's still reasons to do it, even if you're not going to die, right? Like healthcare is pretty resilient. If you're in a rural environment, guess what? You're probably not going to die, but it's still the right thing to do for your patients, and it's great for your practice.
Yeah.
And your patients' lives are evolving. I always say in healthcare, we think that patients tend not to be as tech savvy and that type of thing, but they are experiencing evolution of technology outside the hospital setting. And we need to make our settings just as friendly to the user or the patient, so to speak, as other systems do. So if you want to create an environment where your patient is having a good experience, you need to evolve from what you've done in the past. No patient wants to have you say, hey, can you fax this for me? Or can you, I'll wait 24, 48 hours for this, when they can go somewhere else and they get a different type of service experience. So we
Experience.
need to evolve.
Yeah, it's funny, like watching elderly family members with their technology and they're doing their appointments. So it's they've adapted, and it's
Mhm.
fun to watch. So I know it's made the patient experience a little bit more tolerable. And for me, unfortunately, I'm still one of the old school mindsets. I do like to go to the doctors if I got to go see the doctor. I'm not a big telemed. I haven't bought into that yet, but I'm sure I will at some point.
Well, and I think that's going to be the interesting part is the mindset shift, right? I mean, I talked to my mom and she's like, why did they send me the results electronically? Why didn't they just call me and tell me? Because she would rather have a phone call, right? So our systems of automation actually need to take those preferences into account because she
Mhm.
would like the call, right? She would like it. And as I talked to her, I was like, hey, mom, if it was abnormal, they would have called you. And she's like, oh, really? And I'm like, yeah, exactly. And so she's like, oh, that gives me some comfort. So you look at it, and that goes back to Shereese's point. We need to educate them on what's happening, right? And so
Mhm.
if we've automated the results automatically going to the patient, that's great, but will the patients actually get them? And do we need to change how we educate the patient on the front end so they know what to expect? My mom had no idea. Oh, you mean if there was an abnormal, they would have called and said, hey, you need to come in for an appointment? Yeah,
Mhm.
she would have been totally comforted. Like, okay, no call is a good thing, right? And that actually is a nice thing. So, I think it needs to be personalized to the individual person. I know at MGMA, I think it was the last one I went to, or maybe it was the one before that. I can't remember. The president of MGMA got up and talked about her mom, and was like, "Well, why can't we just schedule this online? That would be a lot easier for me." And you're like, "Yeah, this is a 70-something-year-old lady who's ready to schedule online." She's like, "Yeah, it's much easier. I can look at my schedule. I don't feel the pressure of having to take whatever appointment the person on the phone's saying." And you're like,
Mhm.
yeah, I mean, yeah. So I don't think it's an even age specific. There are some generalities that do make sense, but even within ages, right? There's different tech skills and
Oh yeah,
practices and preferences.
no,
Even with
absolutely.
the example that David just gave, like he said he'd rather see a doctor, but I would question or I would ask David, okay, let's say you went to a doctor for a procedure and everything's going fine, and then your follow-up appointment, what if you're really, really busy and it's just a simple follow-up? Wouldn't you be comfortable doing that in the middle
Oh
of
no,
your day in your own office?
no, absolutely, absolutely. 100%. It's funny. My kids make fun of me because I don't buy Amazon. I like to touch it, feel it, but I know, but no, I do. It is the innovation is we got to adapt to it, and like you said, there's some late adapters and some who are more forward thinking and ahead of the curve. We are getting a couple of questions here from the audience as we kind of get closer to the
Right.
end. I'll grab a few of these, but this one came across. How can healthcare organizations on a budget crunch still strive and implement automation? What are your suggestions?
I always say get in where you fit in. There are so many companies with so many different automation options for healthcare providers. So maybe it's just your registration process. That's a huge win for patients if you can automate that process. where it doesn't cost you a lot of money to implement it. So find a good company. I want to give you a few. I'll have to come back to you on that one because I don't want to call out people and get them inundated with calls. But there are companies that will take you a small project for healthcare providers or your largest project. You don't have to automate your entire system. If you want to start somewhere small, start there and then move up in your automation, because you can always enhance and add things on. But I don't think there's any system out here who can't start somewhere like registration.
And what advice would you give to someone who's looking to carry that conversation for automation to leadership? How would you engage them to get the conversation rolling?
So I would actually reframe the question. Sorry, Shereese.
I always say that you have to go in with the ROI in mind. So you have to know that equation going in. So if you're trying to talk to your leadership about it, while you want to sell the idea that, hey, this will be more convenient for patients or providers or whatever, you 100% have to include the ROI in that conversation for leadership.
Yep.
Go ahead, John. I'm sorry.
Yeah, I would reframe the question. Maybe the reason you have a budget crunch is because you haven't automated, right? Like,
exactly.
You know, like, and can you survive without automation? And to Shereese's point, if you go to a company that can't show you the ROI of the automation, then keep looking, right? Like that's the job of the company, to show you how they're going to increase your revenue collections, or how they're going to increase the number of appointments that you have that's going to drive the revenue that you need, right? You know, and there's a lot of them that will even take skin in the game, right? You know, we're asking provider organizations to do value-based care. Well, there's a lot of healthcare IT organizations that are happy to go in and take the risk with you as well, because they trust their solutions enough to actually provide you the results. And if they don't, then they're full risk with you too, or partial risk, depending on, you know, lots of different ways. So yeah, but I would reframe the question to say, you know, can you have a future without the automation, or is your budget crunch because you didn't implement automation? Maybe a better question.
Yeah, that's a great.
A good place to start for a company that's unsure. Tell them about the claims denials. There's plenty of data out there, and if you're a company, I don't know if this person's company does, you know, their rev cycle is like that. But if you're getting denials of your claims, that's an excellent place to be able to show what difference automation can make, because you can reduce those denials.
Yeah, that was actually, I'm glad you brought that up, because that was actually part two of the question. Like, where would be phase one advice for integration? So that was claims denial, be a great start. Let me see here. Let me just got a couple here. What would you say would be some of the must-haves to have in place? Additionally, you said rev cycle, but what would be like your top three to enhance the workflows?
Yeah,
I would say, okay, go ahead.
Yeah, like, you know, I think the low balances is a great place as well, right? Because low balances by their very nature, you know, are not worth a human, if you will, right? Following up on them. So it's a great place to automate, because, you know, you automate the low balance collections. You know, I think that's a great place. I think automating the patient collection side of things is an incredible one. Now you have to do that in a way that creates a great patient experience. So, you know, you think about that, right? You know, let's move beyond sending them a letter. You know, the best way to not get paid by me is to send me a letter, right? The best way to get paid is to send me a text or email, right? With a link to let me pay it online, et cetera, right? So unfortunately, many of these automation projects are kind of twofold. One is, how do I automate the you know, the outreach, the communication, but then also, do I need to change the experience and automate the experience for them to be able to pay that bill, to do those things? So sometimes it's a multifaceted process that you have to think through to be able to create a great experience. But, you know, I think that the patient collection side, we know patient collections has been increasing with high deductible plans, with you know, patients just wanting to pay on their own, et cetera, where the patient collection piece is just more than what we used to just, you know, we used to just collect from, you know, the payers and be like, well, you know, we'll get enough from patients, right? Well, now that's not the case in my experience with practices. Like, the patient piece has become much more significant, and we need that money. So that's another area that I'd automate.
Great, thank you. Let's say we're closing in on time. Just wanted to take, just if we could, just one more second or just another minute, just to kind of some closing thoughts from the two of you, some expert advice from our panel.
The most expert advice I could give is that automation saves, evolves, and creates an environment, an experience that's good for all.
Yeah.
Start small and build.
Yeah, I would say, you know, be brave, right? You know, be brave, but be thoughtful. And, you know, obviously look to peers and organizations where you can meet peers that are going through it as well, right? You know, I think that's a good place to go, is look to your peers and see what's working for them. But then be brave, you know, as you approach it, you know, you know, you're going to see a lot of success if you experience it on the front end. You know, you know, when I was implementing EMRs and EHRs, I didn't want to be the first person to implement the EHR, but I wanted to see what the first person was doing, right? You know, if there's a new update, I want to see what's happening there, and I want to be involved in that process to provide the feedback, to be able to provide the understanding. You know, so much of this, like, we're still at the early end, you know, going back to the ChatGPT stuff and what it can automate and how it can help, like, is just powerful to think about. But you're not going to be able to take advantage of it if you're not dipping your toe in to see what it's like. Not that you have to dive headfirst in, right? You can be thoughtful in how you approach it, but even just take something as simple as ChatGPT. You know, could we use that for collections letters? Like, why are you writing a collection letter? Could you use ChatGPT to write it for you? And then, of course, you're going to review it. That's human in the loop, right? You're going to be a human to review it and make sure it's quality. But could it solve some of that for you, right? Could that type of automation help you improve? And by experiencing that, by trying it, it'll help you understand and discover other areas where you're like, oh, I do this all the time, I could use that automation here. But if you're just like, well, I'm waiting for it to be mature, you're going to miss out on knowing where it can help you.
Yeah, to your point, get over that fear. And
it's like I always say, the best time to start an automation process was late 2019, and the second best time is right now. Why would you not?
Perfect.
The pandemic taught us a lot, didn't it?
It did, absolutely. Changed the world we live in. Well, I don't see any additional questions coming from the group, but I would like to thank you both for your time and your insights. And for those listening in, if you have any questions, please feel free to reach out to us at Vine Medical, and we'll be happy to provide you with any information to help get you started on your automation journey. And with that, I guess thank you again, and we'll sign off.
Thanks,
Thanks,
you.
David.
Thank you.